I think the closest we come to getting any relief on that is the Accountable Care Organization, because that actually does allow for us to collaborate a little bit differently and a little bit easier. But certainly regulation is unbelievable. We are so highly regulated in just about everything we do, it almost hamstrings you. I would say what's not included is enough transparency. This would be more on the insurance side. There's some crazy things that go on out there. Now, one piece of transparency that came out is that hospitals actually are going to have to publish their fee schedules for certain things that they do. That's never been done before. One of the pieces that I think shouldn't be, that I think should be addressed, is the insurance contracts themselves. They all have confidentiality clauses in them. They won't allow me to talk to you, the employers, about what the insurance company is going to pay me. I could give you my fees. That means nothing to you. What really matters to you, the person that's actually paying the bill, the employer, is what is it that I'm getting paid, and how can we work together to reduce those? Until you can see that piece of the puzzle clearly and do analysis on it, you only have part of the picture. It's the equivalent of walking into the store and picking something up off the shelf, and not knowing anything at all about what it costs until you get to the cash register, and then you have to ring out every item individually, and not until you get home and add up all of the receipts can you sort of start to get the picture. But we ought to be able to share what we get paid from the insurance companies with you to help you make good choices on how and where to purchase your insurance. It also then prevents, in almost every market, one particular insurance company will have a little bit better rates than the rest of the insurance companies. And the one with the good rates, we provide rates so that they turn those rates into discounts and benefits to the employers. But the one that has the best rates, because of this non-transparency, they don't really have to share that discount with the employers. You know what they have to share? The second best. They have to sell just below whoever's got the second best rates. They don't have to convert it all back to discount to the employers. Anyway, so I think there's tremendous work to be done on this issue of complete financial transparency in the market.
Just give you a perspective on that. We will charge $1.45 billion to our patients for care this year. We will collect $650 million. So there's a huge gap between what we bill and what the insurers and what Medicare pay us in that process. And I think the transparency, we'll give Garland a break on this one, but I think transparency hurts competitiveness.
Well, it's not Garland's fault.
It's not. It's not. It's there because I don't think he has the best rates in this market, which competes with him to get out of the process. Unfortunately, I think it does. So with others in the process, it allows somebody, it allows others to, it allows that to be a difference. So it is what it is.
But Jack, you're scaring me. United Healthcare administers our health program, PPD. What are you telling me here?
They administer ours too, so we'll be honest with you. We got them too. So
they administer ours too. So
I think one thing that's important, because I actually agree. I think the transparency is critical. And Jeff, you and I, we've had some work and done some things. There's a lot more to do, but I think from a consumer perspective, the place we want to get to is being able to make selections and choices, and as individuals, not just price, but outcomes. And that's right. What Jeff was talking about earlier, is that transparency around quality. And we are blessed in this community with great providers. That's not true. I was in Tennessee and Arkansas before I came here, so that's not always the case. And making decisions and where best to get services truly is going to become more and more critical. So there is an opportunity to collectively collaborate and create an environment where you can really, truly say, hey, when I've got these disease states, I've got this going on, here's where I want to go, and be able to make that selection. So that's a one potential from all this that can potentially be very, very positive for consumers.
Yep. Let's take one more question from the audience. Table 22, Kathy Erickson. You've mentioned about the shortage of physicians that are projected by 2025, and the same is true of the specialties. But you also said that not every patient needs to see an MD for a sore throat. I agree with that. But what is being done to drive the patients who are resistant to seeing those mid-level providers? As a provider or an insurance company, what are we doing to drive that change?
Yeah, it's going to be a lot of patient education, and some of it you see for example, an example with us is we've instituted more open access. Our convenient cares, our Today cares, we're trying to remove the barriers to accessing care. Well, one of the trade-offs with instant access is provider choice. To provide that access, then you can't necessarily see who you want when you want, but we will provide access for the appropriate level of care. And a lot of times those access needs are being filled by mid-level providers because the acuity of the visit warrants that. That's one way, but patient education, physician education, the need to become more efficient will all be driving factors as that paradigm changes. The physician shortage in and of itself will force us to find different models of appropriate high-quality care.
I mean, the answer to that question as an employer, and I have to credit Fred Eshelman with this, but at several of our PPD sites, we have an in-house company clinic. So for those more routine kind of problems, we send our employees there. I don't know how each one of you individually perceives that as helping you or hurting you, but our employees can for more simple type of issues and less lost time at work, they can go see a nurse practitioner right in our facility and treat some of that simple stuff.
Yeah, right.
So
It's the same
from
kind
an
of
employer's
concept.
perspective, that's positive. But
It's the same concept.
yeah,
And I think from a carrier perspective, what we promote actively is the use of consumer-driven HSA plans. So a consumer's in a situation where they have to make a choice. And again, they have coverage for their preventive services, but when they've got to make a choice, do I try to go to physicians, obviously a physician, do I go to an easier access clinic, do I see a mid-level, those kinds of things. That's where you allow the individual and you give the consumer a choice to make those decisions. And that helps from a selection standpoint.
Kathy, we've done a lot of benefit and plan design changes for our employees, and we've really come to the conclusion to a great degree that choice costs. And if your choices are limited, you can control, we're charging less. If you want to be able to choose from a much wider range of providers to go to, you're going to pay a little bit more. And I think, again, as we go out in this process and as employers design plans and work within the accountable care organizations, you're going to have options which will be able to demonstrate quality, contain costs, but one of the things that might be limited in that process is, to a small degree, is choice. I don't think it's local choice. I think it's regional and it's a larger range, especially when you provide as many services that we do in this community. But if it's cheaper to go to a mid-level than it is to go to a doctor, you have a choice. Pay $20 a copay versus $50 a copay. You got a cold, you've got something that's not horribly complex. That in the process, I think people are going to drive some choices, and I think that's something we're going to have to, that when we do plan design and we get more mid-levels involved in the community, I think that'll be something that we're going to continue to talk about, because what I'm trying to do is hold premiums down for my employees, and again, I'll give them choice so that they can make adult decisions as to where they want to spend their money.
I also think as users of the services have more experiences with these mid-level providers, they become more comfortable with them. We've seen that in the long-term care industry. We have a lot of physicians who have their mid-levels come out and visit our residents, and they're becoming familiar with them, and they actually begin to see them as the provider, whereas in the past, even in that age group of folks, they really just wanted to see the MD. Mm-hmm. And so they have become more comfortable with them over time as they've delivered the services to them.